Hi, this is Alan Gardner, Senior Lecturer in Advanced Clinical Practice at the University of Central Lancashire, and thank you for listening to this video entitled A Focus History of the COVID-19 Pandemic from the discovery of the disease on the 31st of December through to the 23rd of March 2020, which was when the UK officially went into the first lockdown as a result of the virus. The aims of this video then are to explore the events leading up to the UK countrywide lockdown. Now I've placed that in inverted commas because there's no real definition of what we mean by lockdown. It's just become this sort of colloquial term to refer to some very strict public health measures as a result of this particular communicable disease. Now this, if you're watching this video kind of publicly, the intention is that this is actually used as part of some in-class discussion. Currently, many universities, including UCLan, are using distance learning techniques. So this video is to support some in-class discussion via, well, we use Microsoft Teams, but obviously other video calling technology is available. And we're going to be comparing and contrasting the UK response with the timeline by the World Health Organization and a few other sources. So the idea is to actually sort of critique the UK government response, looking at well, what were the strengths of the response, but also what could have been done differently, because obviously this is a once in a lifetime opportunity to experience a pandemic, which means that obviously there's going to be some things that we can learn from this in order to inform future responses to new communicable diseases. So some of the limitations here then are that this is a very focused account. It fails to there's no intention to account for the entirety of the global response and experience of this epidemic. That in itself would be enormous and far too big for this single video. So a pandemic of this nature is extremely complex, and I'm not trying to account for some of the important factors at play here. So for example, there's no analysis of the economic response, or even any sort of idea of the cost-benefit analysis of the subsequent UK lockdown. That may well be something that we discuss in class, but in terms of this video, it's actually very descriptive. So it's just trying to describe the events historically, trying to match up the what we see from the World Health Organization response and what was going on in the UK contemporaneously. So I've extracted some of the key points from various sources to try and provide a meaningful teaching and learning experience. Well, I acknowledge that there's some events that I haven't accounted for, and that's purely down to my own kind of personal subjective opinion as to what was pertinent for this video and what I felt was to be left out. But I think I've managed to hit all the pertinent points as far as the UK is concerned. But when I say that some things were missed out, that's largely what was going on around the rest of the world at any particular time. So here we have the start on the 31st of December 2019, and this is when the World Health Organization in China were first notified of a new case of pneumonia, so a pneumonia of an unknown cause. And if we link this to the idea of the principles of epidemiology, and I've covered these in a separate video prior to this, so that was like part 1 of epidemiology, and then this video is supposed to be part 2 of this discussion. That we know that one of the main principles of epidemiology then is to actually identify new diseases or new cases and characterize them and start to define what's causing a particular disease. We also see here the principle of actually tracing it back to its origins, so that we can start to understand where might this disease have come from, and therefore start to understand which populations are going to be affected immediately. So then we jump forward to the 5th of January 2020, when the World Health Organization published its first risk assessment and advice, but there's still no cases identified outside of Wuhan province in China. We start to see close contact tracing, so we're seeing this epidemiological detective work of tracing back close contacts from people who've tested positive for the virus in order to be able to follow them up for isolation and preventative measures to inhibit the spread of the disease. Here we see that the World Health Organization have previously developed tools that are intended to support countries in their response to communicable respiratory viruses, such as the previous experience with SARS and MERS. Now, further down the line, we understand that actually the virus that causes COVID-19, which at this point it's still yet to be named COVID-19, which we'll see shortly, but that virus is also classified as a SARS. So the virus will be later named SARS-CoV-2, that being an acronym for severe acute respiratory syndrome, CoV being coronavirus, and then this being named 2 because this is the second of these viruses. So we're very quickly seeing the World Health Organization's response is to inform host nations, so the countries that are involved with the World Health Organization individually, so that they are forewarned and that they have the opportunity to start planning for this new disease. So we see here then that China's starting to share genetic sequencing for this, what's referred to as a novel coronavirus. That means it hasn't been identified in humans before. The understanding is that this has been isolated in animals previously, but this is the first time that we've actually seen it transmit from animals to humans. And at this point, we can see that there's been 41 confirmed cases, but only 1 death. And this was in someone with a serious underlying medical condition, which kind of retrospectively, when you look back at this point, you'd be forgiven for thinking, well, that's somewhat reassuring in comparison to some of the information that we now know. It was on the 13th of January when we first saw a case of this particular coronavirus outside of China. This has been attributed to a 61-year-old Chinese lady who boarded an aeroplane on the 8th of January. She had symptoms of a fever, sore throat and headache, and she flew from Wuhan to Thailand. And then she was together with 5 family members in a tour group of 16 people. From this, we can see that the area of Wuhan wasn't under a strict lockdown, that there was still passage of people out of this particular geographical area. So we don't have this time strict containment of cases in this event of this newly discovered disease. On the 28th of January, World Health Organization and the Chinese government are engaged in working together to stop the spread of SARS-CoV-2 within China. This was when these two bodies were working together to implement public health measures such as containment measures within the Wuhan province and public health measures for other cities and provinces around China. As we skip ahead to the 29th of January, we can see that this is when we had our first 2 UK patients test positive for coronavirus. These were 2 Chinese nationals who became unwell while staying in a York hotel. This is further evidence that there was the ability to travel outside of Wuhan province and outside of China, therefore contributing to new cases being identified elsewhere around the world. And it's at this point that we see Britons being evacuated from Wuhan. We have passengers arriving on this aeroplane here at RAF Brize Norton, and then they underwent a subsequent 14-day quarantine at a specialist hospital in Merseyside. On the 30th of January, we have the World Health Organization Director General declaring a public health emergency of international concern. This is when the World Health Organization are really ramping up their communications to host nations that this is something to really be taken seriously. They're acknowledging that there's been cases reported in 5 World Health Organization regions within the same month. And they're really stressing the role of detections of testing and tracing, contact tracing, and isolation of people who are tested positive. The 11th of February, then, this denotes quite a landmark point in our modern history, in this sort of short and focused history of 2020. And this is when we actually see the naming of COVID-19. You can see that then the idea is to avoid generating more stigmatization. So if we compare COVID-19's naming to that of, say, Spanish flu, where that by naming it Spanish flu, we're kind of promoting stigmatization of the Spanish people, when actually it's the origin of the disease is unlikely to have come from Spain. We don't really know exactly where it came from, but it was unnecessarily named after a particular group of people. With COVID-19, a more sort of stigma-heavy name could have been based upon the geographical location, for example, or there's some scientific theories that this has come from an animal, but in particular potentially bats or pangolins. But to avoid that, it's been named COVID-19, so that's coronavirus disease 19, after it being discovered in 2019. This is obviously easily pronounceable, and this name has since become, I can't imagine that there's a single person alive who hasn't heard of this disease now. So unfortunately, the idea of this is to avoid stigmatization and to avoid any sort of blame culture toward a particular peoples or animals. So coming to the 12th of February, then, we continue to see this real ramping up of the World Health Organization's response to COVID-19. They're really stressing the importance of research priorities, so researching diagnostics and vaccination programs, and really stressing the importance of collaboration between experts and between members of the World Health Organization. We come to the 15th of February, when the Director General calls for more solidarity, so continuing this strong message of solidarity and not stigma, and that World Health Organization countries need to pull together to counter the impact of this new virus. And it's on the 17th of February that we see the World Health Organization issue guidance on mass gatherings. Now, this isn't strict guidance. I've looked at it myself, and actually it's very much about risk assessment about the nature of gatherings, and encouraging countries to take action to actually assess the risk of transference of the virus, and whether or not each specific sort of large gathering of people might cause a particular risk of further spread of the disease. It's also offering guidance on managing ill travellers, because as we've seen so far, that we're starting to see transmission of the disease outside of its original area and into different countries. So as people are travelling from one country to the next and then becoming ill, member nations are encouraged to actually manage those specifically through the principles that we've already seen. So positive testing, tracing of close contacts, and isolation protocols. We continue to see this real drive towards preparedness and emergency preparedness. The World Health Organization is shipping supplies of personal protective equipment to 21 member countries. In particular, its focus is toward the developing nations, such as African countries, enabling them to detect COVID-19, or the virus that causes COVID-19. That being kind of the first step in that process of testing and then tracing and then isolating. we're continuing to get a feel for this real voice coming from the World Health Organization of like a call to arms, essentially, that countries need to act quickly in order to control the spread of the virus. That we've got this idea of the window of opportunity is narrowing now, and that's coming directly again from the Director General of the World Health Organization. So throughout the initial stages and the first wave of the epidemic within the UK, I think our closest neighbours really were Italy. They were communicating to us through intensive care networks throughout the first peak, and they were seen as generally being kind of two weeks ahead of us through the early stages of the epidemic. Now, their first case was diagnosed on the 20th of February, and their first death recorded on the 21st of February. It's only a few days later that we see the World Health Organization leading a team of experts to Italy. There being this real focus on limiting further human-to-human transmission, as well as starting to understand how we manage these patients clinically with good infection prevention control, as well as risk communication, so understanding the risk to healthcare workers as well as the general public. On the 26th of February, we see the World Health Organization continuing to push guidance to host nations, really stressing the importance of emergency preparedness and the importance of public health interventions on an individual basis. So good quality hand hygiene, forming one of the the biggest impact for the lowest cost as part of those public health interventions. In the UK, our Health Secretary Matt Hancock addressed Parliament outlining the UK government plan of contain, delay, research and mitigate. At this point, just over 7,000 people have been tested in the UK, with only 13 people tested positive, and 8 of those have been discharged from hospital. And at this point, the government were clear that there was no need for schools to close, and students and staff wouldn't have to go home if there were cases positive at schools, for example. So we're seeing a very kind of low-key version of the government response in comparison to what we've come to see later down the line. Now that we're in, at the time of recording this, we're in the second lockdown. It's now November the 5th. So we already know that a lot changed between the 26th of February and the current position that we're in. On the 28th of February, 800 people are now infected in Italy, and there's cases in 14 other European countries. Sub-Saharan Africa records its first infection, and there's the first death of a British citizen aboard the Diamond Princess, which is the cruise ship that we can see here. UK authorities also confirmed the first case of the illness to be passed on inside the country, so we've got that first transmission of the disease within the UK, and this is the worst week for the global stock market since the 2008 financial crash. And this is when the World Health Organization are again ramping up their alert to the highest level at this point. The 3rd of March is when the World Health Organization announced that there's a shortage of personal protective equipment, and this will really endanger healthcare workers. And this became a big part of the discussion within the media as we progressed through the epidemic, that that PPE was not available at the point of care as it should have been. The UK government launched its coronavirus action plan. This came under some heavy criticism as a herd immunity plan. So there's a lot of discussion about aiming for a 60% infection rate. So 60% of the population of the UK would need to be infected in order to provide herd immunity. But as I say, this was heavily criticised due to the suggestion that there would be excess deaths and healthcare system overwhelm. As we progress to the 4th of March, then we can see that there's a surge in cases, as officials announced the biggest one-day increase so far, as 34 new cases bring the total to 87 within the UK. Now, that probably doesn't sound like a surge from 34 to 87. That still, when we consider that the UK population is about 66 million people, that still sounds statistically a tiny proportion of the population as a whole. However, what we're seeing here then is something that's been discussed in the media quite a lot, this idea of exponential growth, that being that cases will double over a certain period of time. And that's particularly interesting because as numbers start to double, then we see this huge increase over a very short space of time. That's what we mean by exponential growth. And in mathematics, we have this analogy or kind of aphorism or story for demonstrating the importance of exponential growth. And it involves placing grains of rice on a chessboard. There's lots of different versions of this story, but the one I've heard is about grains of rice on a chessboard. So if you place a single grain of rice on the first square of a chessboard, and then place 2 on the next one, and then 4, and then 8, and then continue to double those numbers with each square of the chessboard, by the time you've gotten to the final square, that there's more grains of rice than have ever been in existence, because you're talking about numbers in the billions. So it really doesn't take long before numbers become completely unmanageable through that sort of exponential growth. And in contrast to the UK government response, then within one day, Italy is announcing the shutting of schools and universities. So again, considering that where we were tracking 2 weeks behind Italy, what we're seeing then is a much more strict response in Italy, in contrast to the approach that the government outlined just one day previously. And on the 7th of March, then we see the World Health Organization marking 100,000 cases globally. So we can see then that over just a few months, we've gone from having a small number of cases in a cluster, in a single geographical location, to now it's spreading across multiple countries, and the growth of the frequency of the disease is really starting to ramp up at this point. There's more work here from the World Health Organization to try to manage fear and stigmatization, discrimination during COVID-19, and there were certainly reports within the UK media at this time of Chinese British people being subject to discrimination and very unfair treatment. And again, just calling back to this idea of naming the disease COVID-19 to try and prevent that. That's a really important thing to remember during this time, that we really shouldn't be discriminating against one another, but this is clearly driven by fear and miscommunication. So what we need is good quality science communication at this point, and obviously very compassionate communities in order to try and ensure that we're not actively discriminating against one another at this point. Within the UK, we can see Nadine Dorries here, who was the first MP to test positive for coronavirus, and we have 6 people in the UK who've now died due to the illness. 373 testing positive. Now that's an increase of 360 cases in just 12 days. So again, even just kind of descriptively, that's a significant increase over a very short period of time. It's on the 11th of March that the World Health Organization officially declared COVID-19 as a pandemic. This means then that the original epidemic has now travelled to multiple countries and is now essentially all around the globe. Now the World Health Organization have been kind of criticised on both fronts for this. First of all, because the definition of a pandemic is sometimes seen as being a little washy. That basically the definition is that this is an epidemic that's now seen across multiple countries and has crossed borders into new locations and is now kind of all across the world, essentially. I'm kind of paraphrasing here. But critics will say that, well, there's no sort of specific or objective way of defining a pandemic. So, for example, these people will also say that to define an epidemic, that there needs to be a certain proportion of the of a population that are affected by a disease, and that way there's that objectivity to it. So we've kind of got three key terms to define here. Then we've got this idea of pandemic, which is a new disease that we wouldn't usually see all around the world or in multiple countries. And that's different to an epidemic, which is a new disease that we wouldn't usually see in a particular area. So, for example, well, obviously, as COVID-19 emerged, we wouldn't usually expect to find COVID-19, just as if new cases of malaria popped up in the UK, for example, that we wouldn't expect to find malaria within the UK. So as that started to spread, that could be declared an epidemic. Whereas we also have the term endemic. Now that's levels of disease that we would usually expect to see in a particular population. So our usual levels of seasonal influenza are endemic within populations. On the 13th of March, this is at the point at which Europe is officially recognised as the epicenter of the pandemic. So this is when Europe now has more reported cases and deaths than the rest of the world combined, apart from China. But there's more cases being reported every day in Europe rather than were reported in China at the height of China's epidemic. On the 18th of March, this is when the Solidarity Trial was launched, so World Health Organization and partner nations continuing to collaborate, and the Solidarity Trial is aiming to provide data on effective treatments. So, for example, one of the arms of this trial was originally looking at hydroxychloroquine as a potential treatment for COVID-19. However, that arm of the trial is now being stopped because there's evidence to suggest that it's not effective. Whereas the drug, one of the corticosteroids, dexamethasone, has been proved to be clinically effective in reducing severity in patients who otherwise would develop very severe illness. And at this point, the UK government announces that schools will close. So we've gone from this heavily criticised plan at the beginning of March that was trying to avoid school closures and basically working on herd immunity, that now we're seeing that most schools across England and Wales and Scotland as well are announced to be closing. As we move into the 19th of March, China reports no new local infections for the first time. I remember this being a huge relief within the media, and obviously we're seeing this image here of kind of hope and solidarity between people, and even just that idea of physical closeness now probably seems like quite a long time ago. But yeah, experts at the time were wary to see this as a big landmark, because obviously they need to have zero rates for quite a long time, well, relatively long time, 14 consecutive days, in order for this really to become significant. And as we're approaching the 23rd of March, then on the 20th of March, this is when the UK government ordered pubs, restaurants, gyms, other social venues across the country to close, and we saw the implementation of the furlough scheme, whereby 80% of people's while the government will pay up to 80% of people's wages in order to try and mitigate the economic cost of such strict public health measures. And this is the point at which my university, University of Central Lancashire, closed its campus and teaching moved to online, along with any other services that possibly could do. And now we approach the 23rd of March, which is when there was this televised address to the nation, much like kind of akin to going to war, I suppose. That was certainly part of the rhetoric around this at the time. Quite a groundbreaking set of public health measures that we're now seeing worldwide cases at 270,000 and 11,000 deaths, and mathematical modelling at the time was suggesting that the softer public health measures that the government had originally planned for were going to be ineffective. And one of the key issues here was the idea of overwhelm to the healthcare system, so overwhelming the NHS with the requirement of care for people with severe illness. This brings us to the end then. So I said I was going to talk from look at this focus history from the 31st of December through to the 23rd of March. As I originally said, this is very descriptive. This is purely just describing the perspective of the outbreak of the disease from China through to its effects here in the UK at the beginning of the first lockdown. I think this is an important sort of modern piece of history. Therefore, just understanding that timeline can be really useful. But we're going to go on to some important class discussion that really analyses these responses in a bit more detail. So thank you very much for listening, and I will speak to you again soon.